Did you know that according to research, 7 out of 10 people are impacted by trauma every year in the United States? What that means is that it's so important for us to be able to understand trauma, to know what trauma looks like when it comes into our offices, so that we can provide much more attuned treatment to the clients who are reaching out to us. You know, when it comes to treating trauma, if we apply regular kind of therapy or if we apply regular kind of interventions like therapeutic interventions or, therapy that's not trauma informed, then our clients will not be making the shifts that are needed. So that's why I'm so excited that you're here and that you are committed and passionate about learning about how do you treat trauma. What does trauma look like? How does it impact your clients behaviorally? How does it impact their functioning? How does it impact their moods? What does it look like in their work lives, in their love lives, in their spiritual lives, in parenting, in their sexual lives? So I really want to teach you how to understand all of that. Okay, and the reason it's so important is because the prevalence is a lot more significant than I think many people know. And the really good news is that once you're trained in trauma, then you pick up on it. You develop those cues where you just pick up on it, and then you integrate the trauma-informed care in your practice. So if you're working with clients with trauma, with clients that don't have trauma or have less trauma, getting this training is just going to give you so much more confidence and skill and wisdom that will help those clients that are needing the trauma-informed work, and will help your clients who are, not even needing the trauma, but it will really just deepen your skill and your confidence in this field. So let's talk about what you're going to get out of this course. So number one, we are going to be defining trauma, okay? I'm going to be teaching you, the sensitivities of picking up on, the trauma definitions, how trauma looks, what trauma feels like, how trauma impacts your clients, the obvious signs and the not so obvious signs. The second thing that I'm going to be teaching you are the common trauma types. Now, obviously, trauma has different way that it impacts people, but there is like shock trauma, there's developmental trauma, there's betrayal trauma, right? So there's different kinds of traumas that we're going to go through. And the reason it matters for treatment is because it will impact the kind of treatment and how you structure treatment. Okay, so defining trauma and the sensitivities, what the symptoms look like, so you know what trauma is, the primary kinds of trauma. I'm going to be teaching you my 4-phase trauma model. When we work with the trauma model, then we structure treatment based on the latest research of what's going to be effective for good clinical outcomes. So, when a client comes in with certain symptoms, then I want you to be able to educate them on where they're at in the trauma healing. And then you track symptoms and, symptom reduction to know what phase of healing you're in. I'll teach you how to use the model, how you educate you, so then you can educate your clients on the treatment model. I'm going to be teaching you 5 popular trauma assessments and how to administer them, how do you assess someone for, trauma symptoms and a lot of other assessments that are needed, but 5 assessments. And I'm going to be teaching you 5 interventions for each phase in the trauma healing. Okay, so just as a review, defining trauma, being able to pick up on trauma symptoms, having that extra sensitivity, the primary kinds of trauma, how to know what kind of trauma your client's coming in with. Sometimes they have more than one, that's okay, you want to structure it. I'm going to be teaching you the 4-phase trauma model, how to use it. I'm going to be teaching you 5 assessments for trauma, and I'm going to be teaching you 5 interventions for each one of the 4 phases of the trauma treatment method.